Then, of course, you got the collaborative. That's where we have team members. Yes?
It says change abdominal dressings every shift, that you would need an order for that? You would think that.
No, the doctor would give us an order. He really would. Now, the first surgical dressing, I will tell you, now probably on your ATI, the first one's changed by the surgeon. And then he'll give you orders. Dressing changes Q4 hours or Q shift and PRN. And whatever he prescribes is whatever cream, antibiotic, ointment. Yes.
But checking the blood sugar.
Could be, because he could order Accuchecks AC and HS.
Is that dependent or independent? That's something you can do on your own?
Accuchecks AC and HS would be like the doctor order. But you walk in, I walk in and I see you're my patient and you're diaphragmatic and you're feeling shaky and dizzy. I grab my Accucheck machine and I check your blood sugar because I believe that you have a low blood sugar and it takes 1 minute. I make a decision, an independent nursing decision, that I need to check that blood sugar. And in fact, what is it? It's 45. I'm able to be proactive on your calls, have you take some orange juice or whatever, and then I call the physician and let him know. And what he says is, I want to monitor her blood sugar. Let's put her on Q4-hour Accuchecks. See how that can happen?
So you're saying like if it was a certain a situation where you see your patient, that would be independent?
Yeah, I'm not going to order medication though. I'm not going to arbitrarily, but something that I know that I do routinely, like an Accucheck. The doctor can order Accucheck AC, that means before meals and at bedtime. That's something that he's, that in a sense, that becomes that dependent. But then in the middle of the night, I'm doing my rounds and I note that the patient's diaphoretic and they're telling me they're shaky. And I know they got a history of diabetes. I already know that we have that person on Accuchecks, AC and HS, but they might not be too, you know. But in my mind, I'm doing a critical action. I'm taking care of my patient and I'm trying to rule out what could be going on here. I bring in the Accucheck machine, I check, it's 45. I give her some orange juice and I put a call out to the doctor and I say, you know, patient so-and-so, I was doing my walking rounds and this is what I uncovered. I did an Accucheck, it's 45, I gave her juice. And she will say, well, let's put her on Accuchecks every 4 hours for now and watch her and see what's going on with her. Because we have prevented something from happening, an untoward event from happening. So you see how sometimes they could be both ways, in a way. A doctor's order, that's a dependent. He can put Accucheck, AC, and HS. That's a doctor's order, and they will, you know. Does that make sense? And then those collaborative, like I said, those are the other health team members. You have a dietitian consult. They come in and talk to them about nutritional practices. Physical therapist, I told you, a physical therapist came in post-cabbage, open heart surgery. They're working with them, helping them to help them be able to get around at their home, because, you know, 3 days post-op, their discharge from Texas, right? Fast, yes.
When it's a positive team effort like that, you as RN, is it your responsibility to give each team member a call to make sure you're there, or?
What you'll do is, like, say the patient's expressing some lack of understanding about their diet. What you can do is you can put in a nurse, it can be a nursing consult, a nursing intervention. You can consult dietary to come talk to this patient. You can let the doctor know that you consulted dietary. And the reason you do this, I'll tell you why. Because you want the doctor to physically write that as an order because of why. What would y'all think why? in this world of social or economics. The insurance, payment, that's how they'll get paid, the nutrition, the dietary. So you see, as crazy as this is, the common sense would say, yes, I need to have the dietitian to come in, talk to them about better choices. But I do need to let the doctor know to go ahead and write that as an order, because the reality is so that the dietitian will get, so insurance will get, they'll honor that. As crazy as that sounds. It's just the way it works now. In the military now, it's not going to be that issue. So y'all don't have to worry. In the military, they just whatever it just is, and it's done. They don't have to worry about things like that. But in these for-profit or these non-profit, where they're having to meet Medicare and Medicaid issues and private insurances, you've got to do these things, you see. All right, let's see. Deciding which interventions to use. So if you look on page 104, you'll see these standards, these planning interventions. And remember, as a nurse, you're responsible for choosing the nursing interventions. And again, even from the Unit 1, we talked about delegation and who delegates, who do you delegate to? And you recall we say the nurse, the RN, cannot delegate assessments to LVNs or lower, right? The LVN, while might be working in a nursing home, still they have an RN that's over the house for practical purposes. The DON has to be an RN. There has to be an RN somewhere in the mix that finally has to sign off on something. But so just remember, if you're the RN, you delegate to someone you know that's competent to handle it and it's within their scope of practice, right?
Yeah.
So you got to know the standards of care and who's the scopes, and you can find that. Actually, you can go to the Texas Board of Nursing. They got they got a little search bar. You can say type in standards of care, and it'll pop up so that you can, because that could be on state boards actually. That could be a question in terms of delegation of what is appropriate to delegate to a CNA, LVN, you know what I'm saying there. But remember, whatever you delegate, you're really ultimately accountable for. You're accountable for whatever happens, period. You know, so you make sure you educate your LVNs and your CNAs and have strong support, but then don't you dare let them take over your responsibilities. That is not, then that's improper. Your job is to always do the assessments as the RN. Critical pathways, we talked about it already. I think I can even go past this, right? Is that fair? This what I gave you here is just like, it's a type, I found it on the internet. And it's actually like a decision tree. You know, you can, if it's a yes, you do this, if it's a no, do that. You guys, these are algorithms. You guys all get CPR before you came in here. Didn't they show you some algorithm kinds of, you know, these little pocket algorithms that gave you decisions on if you see this, you must do that, or you know what I'm talking about, right? Mm-hmm. Some of you probably bought some of those things in preparation for nursing school. I don't know. All right, we're moving on. Let's talk about that. Priorities. How problem status influences nursing interventions. You got to know what the important priority is. And what happens is, what's important is your observation and your assessment. You're always assessing. Always on the NCLEX question, if you have a question and one of the answer stems is something dealing with assessment, I highly recommend you go to that answer selection. You always assess before you do anything. You see what I'm saying? Always remember that. Prevention to help keep the problem from becoming worse. Be proactive. See what I did this morning before I even started this? I was being proactive with you guys, wasn't I? I went over that ATI with you. And some of you, you say, well, do I have to do this focus review if it's not required, if it's not in the... But see, that's not what I'm all about. I'm about sharing this information, and I want y'all to be proactive adult learners, and you go with it. You go with what I've taught you, showed you. It makes you a stronger nursing student, which will equate to a stronger nurse. 2 years will happen fast, guys. Be kicked out of the nest. See, it'll be gone before you know it. But it's going to make you a stronger nursing student, so you will succeed course after course after course. Because what will you do? Every time you go from one course to the next, what are you going to be doing? You're going to go right into that ATI and see what it is that you can get into already to prepare yourself. Do you see what I'm saying? For the next course. You don't no longer need me. I could drop dead tomorrow, and you know how to navigate and be successful, and you know how to use those skills modules, and you know how to go in and dissect those ATI practice questions and those ATI tutorial practice and even the tutorial final question test, right? You don't need me. You know, if you have problems with your test taking skills, you know to go to the tutorials under Nurse Logic, right? You guys know, and when you open up those open up those little plus boxes, it opens up into other avenues, and you have trouble with choosing between two answers, and you would listen to that module. You know how to do this stuff. You know how to create your focused review. You create them off of your practice assessments, and you create them off of any of your proctored assessments that you will take. And you know that you'll automatically do these things. That's prevention, isn't it? See, that's an example. That's a better example than using the patient. See how I told you I call my students my patients. And then treatment, relieving the symptoms. That's what we hope for. We hope for relief of anything. You guys, your symptoms are going to be relieved. You're going to do quite well on your tests and your ATIs because you have the secrets. You now know the secrets, which leads to health promotion. You're achieving a higher level. All of you's going to make level 3s on both your pharmacology and your fundamentals ATI proctored. That's where you get those levels, the proctored assessments. That comes at the end. And then we go back to thinking about this nursing interventions and how to write them. And always remember what is most important. Go back to Maslow's, those physiological needs. Safety and the ABCs, that's airway, breathing, circulation, or blood pressure, whatever you want to say. It's circulation and the breathing, right? Those are what's important. If without that, we don't survive. We are non-existent. We die. Just like, unfortunately, my son called me and his best friend, he died this morning. It is shocking. 24. You know, one doesn't know when their last day is. It's quite shocking. I used to get so aggravated with that guy, too, because I thought he was leading my son down the wrong path. The truth is, my son was wild as heck. And he would have, even in the hospital, I didn't realize how sick. I went to the university hospital system. It was back before the summer course started. And then I saw a different person. I saw a guy that he got married and had a kid. He actually had a kid. And very polite. And I was quite emotionally torn up. And I gave him some, you know, I wrote a check for him and his wife, because, you know, they're poor. You know, you can imagine what enormous cost he has incurred with being that sick and having a baby and, you know, et cetera. And I got my cell phone out and I let him talk to my son, who's up in Arkansas. See, they're apart. And he gave my son one of the best talks, very mature talks, say you got to settle down, stop that drinking, see. Get right, get on track, know what's important. And see, of course, my son's very emotional about what because he had tumors, he had them in his brain, and you could see where they had started cutting out of his skull, these places. It was shot, very handsome guy, very handsome, about 6 foot tall. His eyes would be rolling back in his head. He just looked like a skeleton. He was that thin, he'd lost so much weight. Very nice looking guy prior to this, and it was just a shock to my system to see him in that state, because see, I remember him getting in trouble with my son. You see where where your mind goes, and then he gave him such a talk over the phone, and they were, my son, I'm sure, you know, on the other end he was crying, and then and his friend was saying, I can't cry, because when I cry, I've got, Ryan, don't cry, because it makes me sad, and when it makes me sad, it causes pressure. So he's trying to explain it to him, because he had the tumors all in his brain too, see. And then they had tumors all over, apparently. It was so much, I could not believe that he had that much. It was hard for me to even believe what my son was telling me, but it was really all along, it was true. You know, because you see him in a different light, where he's driving, you know, ripping the roads, and they're drinking the 12-pack of beer, and they had no business doing that, you know. You see what I'm saying? Mm-hmm. Life ends in a flash. So make this your best run. Do the best you can to help the most people, and that's what you guys are doing. That's my spiritual talk. See, compliments of my son from this morning. But safety first. Safety and ABCs. If you can't figure out anything on the NCLEX, if you can't know anything, look at those question stems and look for the safety and the ABCs. Assessment, ABCs, and safety. Can't say enough about that. Nursing intervention classifications. As the RN, you're responsible for choosing those appropriate interventions. And you are responsible for writing these orders, these nursing orders. That's your responsibility. It's not the LVN. It's not the LVN's responsibility to go in there, assess the patient, and then create this. That's a no-no. You, the RN, you're getting the extra pay, so yes, you're going to do it. So, but there's plenty of tools out there to help you. This is something, and I did this in honor of Ms. Alcazay. Though I do have my master's is in home health and community. It's tied together. I didn't actually get my master's in critical care. I went to a school where they were just starting up. That was what their master's degree was in. So, doesn't matter. It all runs together, you know, after so many years. You know, you're going to do whatever you want to do. I want to go back and work in the ICU after I got my master's. I only got my master's because in case I hurt my back. See, you always got to think ahead. Because I just wanted to work direct patient care, but now I've gotten older, I'm over 50, and I got to drop about 80 pounds, and then I could go back into the ICU, but I got to get rid of this extra poundage, see. I gained this weight once too many times to the Taco Cabana. But you know, y'all take good care of your health. Wear tan hose when you're working the floors. Those concrete floors are just play havoc and they'll cause you to have varicose veins. Not tan hose just for your patients, tan hose for yourself. They sell them at those nursing shops, those nursing uniform shops. TEDs,
Like them
support stockings.
stockings.
Yeah, they're
Lady
real thick
stockings.
support stockings. Y'all get them for yourselves, I'm telling you. At least you have terrible varicose veins because you're walking on concrete all this time, standing. See, I do 12-hour shift. Most of the time I'd be standing because I have 3 patients on ventilators. I'd go from room to room to room, and I never did sit down hardly at all. You know, factor that in 20-plus years, you know, you got some bad damage to your legs. Your legs, you go home, you're hurting really bad. Just remember that. I've told y'all so you don't get varicose veins. Anyway, the Omaha system, that was a system developed for community health nurses, and it's speaking in terms of wellness. Guys, listen up. Omaha system, community health, and it speaks and addresses toward wellness situations. Because several of you, I know when you get done here, you're going to be home health nurses. I just believe it. We are going toward that kind of stage in healthcare. It's not the hospital that what they are seeing, what they see for successful hospitals are, it used to be if they were full. Now they have more success if they're empty. They have more profits. There's been so many hospitals that sort of have gone under. So what they see now is where the profit margin is being proactive. Healthy People 2020. How can we maintain patients or people in a healthy state for as long as possible without them being hospitalized, you see? Y'all understand what I'm saying? And it just makes sense. Majority of people are not in nursing homes. These older people, they're not in nursing homes. They're living in their own homes. Their home is their nursing home. My mom's home was her nursing home. I promised her I will never put you in a nursing home. I'm not knocking nursing homes, by the way. I'm just saying your home is going to be your nursing home. That's what she wanted. Most elderly, you'll find them living in their homes. So what can we do to help them is if we could have the ability to go out and visit them, do health checks out there, promoting health in the community. We're on chapter 7. I wish to try to get through this so that then give you a break and then y'all break up in your groups. Sounds fair? Shouldn't be too much in this one, but I can't promise you. I can't remember what I put in here. I'm doing so much creation. Implementation and evaluation. You will perform or delegate the planned interventions. The implementation phase ends when you document the nursing actions in the chart. So how do you prepare for the implementation? Before beginning a nursing activity, you review. You review, reflect, you assess. Always do these things. If you're unfamiliar with a medication, for instance, you look it up or you call a pharmacist, right? You don't just up and arbitrarily give it. You want to understand what those consequences of it is. Can you perform an activity safely alone? You're in the nursing homes. I will couple my students together because I want to make sure they're safe. I want them to be able to work together in a team approach for the safety and welfare of the patients. Can I safely assist this patient up out of bed to the bathroom alone? You have to assess this. Can I insert a Foley catheter if a patient's too weak to maintain the certain pose, or do I need an assistant to help? These things you should be able to determine through critical thinking, common sense. You might have to ask a colleague to help, but don't, for God's sakes, don't be afraid to ask for help. If you don't know something, ask. It's worse to do something because once once you've done something, you can't take it back, right? Make sure it's not going to cause increased stress on your patient if you do whatever activity alone. If you don't think you can do it alone, get help. Just remember, we're there to have positive effects on our patients, not create chaos. Organize your work. Organizing and establishing feedback points. You guys would want to get feedback from me, won't you? If you're in the skills lab, how did I do? Or, you know, or I'll tell you, just like yesterday as we were wrapping up our clinical day, I said, you guys did fantastic. You know, I gave them a global, you know, sometimes. I said, it's what all I ask is to take good care of our patients. We don't cause the stress. That you guys want to know how you did on your test, right? Y'all want to know. It's just the ways y'all are. It's the way I was, right? Hence, tomorrow I'll give you that piece of paper, and after you take your test, we'll get the answers, and then you want to review the test. What will you do? You come upstairs, and I don't care if all of you's come. It don't matter to me. Whatever you want to do. You want to be very organized when you're getting ready to do a procedure. What does you do? You check and reflect and determine that you are qualified and you can do the procedure. Otherwise, you'll read up, ask for help, you gather your equipment, right? You let your patient know what's coming up, things like that. Be prepared, be proactive, preparing the patient. Check your assumptions. You know, don't assume nothing, right? And then check on your patient's readiness for something. For instance, here's some examples. Ms. Moore's patient was anxious about his test results. Ms. Moore postponed the teaching session until he felt calmer. Because if you are anxious, you're not going to be, you won't have tunnel vision, you're not going to be ready to learn anything. It's going to be a waste of time, isn't it? That's the way it is for anybody. Just common sense, right? Painful dressing change. Nurse discovered patient had visitors. Let's let them at least have a pleasant visit before we do the painful dressing change. Just don't escort them out. Well, got to do this dressing change. See, that's rude, right? Rudeness. Let's don't be rude. After both you and the patient are prepared, it's time to act. Nursing actions include both those you do yourself and those that you may delegate others to do. So remember, if you delegate something, you make sure that they are competent to carry it out. Make sure. If you're doing it, like here's an example, inserting the IV catheter, there's some skills that you need to know. There's some knowledge skills, cognitive knowledge of sterile procedure, which you guys will learn. You got to know how to interact with your patient and reassure them. Right? That first time be sort of shaky. Well, no, I've never started an IV before. But I've got my instructor here. You know, so I'll be there and I'll be over you and I'll help if I have to take your hand and help you find that thing to click it or clip it to get it in there for that blood return. But that first time be shaky, but you know, repetition, when you do anything over and over, you get more skilled at it, right? And just the ability, your psycho and your dexterity of doing things. And we do have IV medic and arms in our skills lab, so don't worry about that. That comes down the road, guys. That's not this course. That's just an example. Different interventions require different levels of participation. So remember, and I bolded this, there are some situations where successful accomplishment of intervention is dependent upon the patient to adhere to the therapy. Here's the example. Patients needs to be found